My name is Anne, and I work at the OSU College of Public Health Center for Health Outcomes and Policy Evaluation Studies. Thank you for joining us on our fifth session, examining the intersection between reproductive health and substance use disorders among women. So this session, like all of our others, are presented in partnership with our Center for Public Health Practice. And sorry, I'm frozen. And all of our great partners that are listed on this slide. They have helped us with developing the content for this series, as well as getting speakers. So of course, I think some of you have been with us since the beginning, and you can probably recite this yourself, but everyone is automatically muted and video is disabled upon entry. All sessions will be recorded and emailed after, and slides will be available on our website as well. If you have any questions, you can put them into the Q&A or use the chat function. At the end of our presentation, we would like it to be more discussion oriented, so I will try to unmute everyone so we can have a conversation. And finally, for CEUs, you will need to complete an evaluation, and I'll email that to everyone probably at the beginning of next week. And certifications will be sent in the end of December or the beginning of January for the whole series. So today we are just taking an opportunity to give a summary of the contents that we've had so far, discuss some funding opportunities, and then move into some planning discussions for potential new initiatives at your respective organizations. So we really wanted to make sure that we gave participants a template for action instead of just continue to provide information. And I hope with Kelly, I'll let her introduce herself soon, that we can have a really fruitful conversation about some next steps for all our partners at different organizations. So Kelly, if you can just introduce yourself and give a little background about the center and your work there, and then we can continue.
Sure, thank you. Can you hear me okay?
Yes.
Okay, just making sure. So my name is Kelly Bragg, and I am a program manager with the Center for Public Health Practice, which is within the College of Public Health. We're a small center that we primarily exist to do sort of workforce development and organizational development projects. So in my sort of daily life, I do a lot of organizational development projects with local public health agencies across the state. But we also have programs focusing on mental health awareness. We do some resiliency work with middle schools, and we do a regional workforce development project through the University of Michigan. So we do our best to adapt to the changing landscape of what public health needs in the state and the region.
Thank you, Kelly. Okay, there's quite a lag today. So in our first session, we had a series of wonderful speakers who highlighted some tenets, philosophies for doing work related to reproductive health and substance use disorder. And the first one of those tenets is reproductive health as a human right. So really examining those services and being able to provide support for people using the lens that reproductive justice is a human right to control our bodies, our lives, sexualities, gender, work, and reproduction. And then we had a brief conversation about the importance of race and racism, especially related to the war on drugs and how we criminalize people with substance use disorder in America, especially those who are from minority populations. Another tenet that was really important for establishing a framework of understanding is that recovery is more than just abstinence. Recovery is really building a life of integrity, connection, purpose, serenity, and reproductive and sexual freedom. We had Indra, who is a lawyer, discuss some health and legal factors for women with substance use disorder and how providers really do need to pay special attention to those considerations at the intersection of the justice system and reproductive health. And then validating lived experiences. I think a lot of us on this call already understand how important it is to validate and lift up the stories and experiences of some of our clients. So even though we did focus a lot on access to contraception, we really want to highlight the fact that there is a broader spectrum of services and opportunities for providers to continue to improve the reproductive health for women. So it's really about continued engagement and continued education for all of the people we serve. And then within that, to really use the life course perspective to examine what we need to do at certain times, given a woman's reproductive health lifespan. And finally, just to highlight again, because we are working with high needs and high risk populations, to always use a trauma-informed approach when designing initiatives and programs. So I just took a slide from one of our speakers that really did a good job highlighting some of the potential challenges with working within the harm reduction and reproductive health space. So the first one is really to do the work and make dignity the center of everything that we design. Also to pay attention to stigma and the specific medical barriers that some of our clients might have already experienced within the different systems that they interact with. Again, making sure that we provide services without criminalization and without surveillance. Some of the populations that we might serve might not have good relationships with public health institutions or institutions of law. So we do really need to, I think, evaluate different perspectives and where some of our clients might be coming from as far as trust and relationship building. And then I think finally, just to understand that in addition to clinical supports, social supports for our clients are very important as well. So this is a slide that, again, I took from another speaker who was a lawyer who helped us talk about some of the policy challenges. There were a lot of questions from the first session about the very sensitive nature around working with women who use drugs who are pregnant, and then also child welfare issues. And my main takeaway from that is that you can do your best to support and uphold individual dignities without breaking the law, and also understand that there are things about certain policies that we might want to change. I would just stall here a little bit to highlight the fact that all of these slides and recordings are available on our website, and I can share that link with you if you email me. So in session 2, we began highlighting some programs, and the first type of programs that we highlighted were those that integrated physical and behavioral health care for pregnant and parenting women with substance use disorders. So we had those 4 programs highlighted, and they really were good examples of some of the philosophies and tenets that our opening speakers provided. In the third session, we looked at integrated healthcare for women at substance use treatment settings. One of the things that I really want to highlight is the simplicity, effectiveness, and beauty of the One Key Question initiative to appropriately begin conversations about reproductive health with women at any setting, not just substance use treatment settings. In our fourth session, we looked at some other initiatives at community settings like Planned Parenthood clinics, needle exchange programs, and then also what's happening with women who are incarcerated. So I know that this is a very quick overview of some of the themes that we saw, but again, you can access the information in more detail if you go on our website. So next, I wanted to highlight some funding opportunities to give everyone an idea of the types of resources that might be available if you're considering a new initiative. I won't go over all of the information, but I will highlight that there is a live link to get more information on every slide. So the PCORI grant, which is the Patient-Centered Outcomes Research Institute grant, is a pretty big deal. I think it's pretty competitive, but it is currently open. And you can apply for the grant to get a deeper understanding of the needs in your community for different clinical outcomes. So in our case, it would be reproductive health services for women with substance use disorder. There are some foundation grants as well. So we highlighted 2 Robert Wood Johnson Foundation grants. One is the Evidence for Action, and the other is the Pioneering Ideas grant. These are accepted on a rolling basis. So if you have a great idea and you have partners and a logic model available, you can apply whenever you're ready for these opportunities. This one is specifically related to what's happening around COVID. So you can apply for this foundation grant. It's a smaller scale one, but not an insignificant amount of money. And then finally, some SAMSA opportunities. I want to note that these are no longer active, but they do give you an idea of what has been funded and some of the targeted areas for research that are supported. So transitioning to some planning for new initiatives. This is kind of a model that I developed as I looked over some of our materials. So first, to develop partnerships and engage people that you want to work with. Understand what types of resources you need to develop and grow and implement a new initiative. And then, of course, going straight into developing your logic model or program theory. I think getting feedback from stakeholders, people with lived experience, community leaders, even your colleagues is really important before you finalize your logic model. And then from your logic model, you can develop a work plan and then ultimately an evaluation plan. And all of this should be iterative until you actually finalize your plan. And then of course, when you have all these documents and tools ready, you can then go after funding. So I have some examples of logic models here, and I will let Kelly jump in if she wants. But to me, the most important sections of a logic model are activities and then outcomes, defined by short-term, intermediate term, and long-term. There are other things that people add to different logic models, like goals or vision. But really, to me, what is most important is what are you doing and what is the reason you're doing that? And then if you are successful, what are the expected outcomes that a funder can see based on the investments that they give you? Kelly, do you have anything to add?
I would just say that I was a very late adopter to the value of logic models. And every time I try and say they're not as good as other, like just starting with an action plan, I talk myself out of it because I don't know if I can pick a best part, because I think it's just it's your way of organizing everything that you have and everything you want to do in one place, which is very, very important when you're trying to get these applications together. So, you know, and it does allow for short-term and long-term outcomes. And so I just think like I said, I fought them for a really long time because I don't like change very much, but they are really, really valuable tools when you're doing this work. I like to put the evaluation across the bottom too. I would say that that's not
Yes,
represented up
that's a
here.
great point. I appreciate that plug. And I think logic models are very good tools for quickly communicating all of the components of your program. So I think as a communication tool, it's very effective as well.
Yeah.
So this is a template of a work plan that I developed for another grant. So I'm biased because I made it, but I typically like to see it by week, in the month, and then by activities. And of course, you can lay it out as a Gantt chart so you can see what all needs to happen by a certain time. Kelly, do you have any templates you like to use?
No, I also love a Gantt chart. I use them a lot, both in my grant work and also just my project management work, because I like that you can color code them. You can, so each person involved has a different color, or each component of the project. So I find them to be a really good organizational tool.
Great. Thanks for your approval. So then from the logic model and the work plan, and again, I'm biased because I love evaluation, we can start to develop an evaluation plan. And really the evaluation plan or your evaluator should be working with you very early on in your theory of change or program development. And there are formative evaluations or process evaluations that start near the beginning, and then outcomes evaluations that start near the end. So typically within an evaluation plan, I like to have a list of indicators and measures, a clear visualization of the data collection system, along with how frequently everything is being documented and reported, and then a plan for who is monitoring the data and what the reporting might look like, so that all partners involved can have an understanding of whether something is efficient or working well or not working well. So I would recommend everyone to get an evaluator on board as soon as possible so they can work along with you to develop your program theory, and then also get a more intimate understanding of what's happening so they can develop sensitive indicators for your work. Kelly, do you have anything to add here?
I don't. I just would underscore what you said. Evaluation isn't my specialty. So I think it does take, there's a specific art to evaluation, and I think it's, your grant will be much more successful if you consider this at the onset of what you're planning.
Mm-hmm. Oh, yep. And then that's it. That's all we had today. We didn't really want to cancel this session because, again, we wanted to give you some tools for next steps. So I will stop sharing and then just open it up for questions if anyone has any questions. And yes, the slides will be available after the panel. So I'm just going to do a quick experiment for engagement. I see that there are almost 100 participants joining us. If I can just get a few to kind of offer any ideas since the beginning of the series, if you have thought of any new ideas or initiatives for your organization, if you could kindly put them into the chat and share them, we might be able to discuss them as a group and potentially take more steps to help you develop out your program theory. So I do have a question that says, are we willing to send share templates and examples of work plans and logic models? Absolutely. Not all of them might be related to reproductive health or substance use disorder, but we can definitely send you templates of our favorite work plans and evaluation plans. Okay, well, I'm going to go back to some of the other slides that we have to motivate you. Oh, and I can also share that our December session will have a panel of speakers from the Ohio Department of Health, a nonprofit called Perinatal Harm Reduction, and then we are trying to get one other speaker either from the CDC or HRSA to join us. So hopefully they can speak to national level strategies that some of us can tap into to try to move along some of these policies and initiatives. Okay, so I have some questions in the chat that I see. Does Ohio have a PIP BHC grant? I'm not sure what that is, Candace. Can you clarify? Oh, primary integration. I'm not sure about that. I know that Ohio has been a part of a lot of learning collaboratives related to maternal and child health, but I'm not sure if, oh, go ahead.
It's a SAMSA grant program. It's
Do you know if Ohio has one right now, Kelly?
that I'm not sure of.
Okay.
But yeah, it's an acronym. Something integration of primary and behavioral.
Okay, yeah. I'm not sure about that. So I'll have to get back to you, Candace. And then Melissa asks, are there common measures that are being used nationally that could use local input or locals can align with? So thank you for this question. There is an online tool called PhenX, PHENX, and it is a collection of standardized indicators and measures across different health topics and issues. So I would recommend going there. But for reproductive health or women's health, I would also recommend Healthy People 2020. Some of those indicators are really good. And then I think a long time ago, AmChip developed the life course indicators, and they also have reproductive health indicators. So there are a lot of different resources to help different programs and initiatives try to standardize what they're measuring and how they're measuring it. So we can all compare our data to other people's data. So thank you for that question, Melissa. Standardizing is always really important. And then Karen says, some of us have talked offline about validating the client experience of care evaluation tool. Yes, that's great. Let me stop sharing my screen so I can drive this a little bit better. Karen, let me unmute you, and then I'll have you speak to what's been happening if you'd like. So Karen, can you give us more information about what has happened since you've gotten some new partnerships?
Yeah, can you hear me okay?
Yes.
Let's see, I had some different people reach out that were in the audience when I spoke. They reached out over email and expressed interest in using that client experience of care tool that I used in my DMP project. The tool was adapted from the IQFP tool that was developed by Dr. Christine Dellendorf. And that has been validated, but we adapted it to kind of be upstream, if you will. The original tool was designed to measure client experience of care with contraception counseling appointments. And we wanted something to measure the client experience of care with the screening process that, you know, whether they wanted to do preconception or contraception or somewhere in between care. So that's been kind of fun to email back and forth with some different people interested in using that sort of evaluation of the screening process tool. So we don't have anything in place yet, but it has been nice that this platform has led to other conversations. Yeah.
That's awesome. Thank you for sharing.
Thanks.
Okay, others with questions or even discussion topics? Kelly, can you drop your email into the chat so people can reach out to you and or I? Everyone has my email address, I think. I guess I'm really wanting to hear from others in Ohio about whether you're thinking of developing an initiative or a program within the upcoming year. Because we would really, at OSU, we would really love to partner with you, especially around evaluation. But there are other initiatives related to the opioid crisis that we're a part of as well. So I would love to be able to make some of those connections for our partners in Ohio. Okay. I guess people are in kind of an afternoon slump. Kelly, can you speak to any of your experiences developing new initiatives? Let's use an example from like a health department. I don't mean to put you on the spot.
Okay. I mean, yes, I can talk.
Yeah.
So when I do the majority of the work I do with health departments is doing their community health improvement plans. So my perspective has been that a lot of times small health departments that are not very, they don't have a lot of resources, oftentimes discount their ability to do any work that they don't already have. So making them understand that sometimes you have to write a grant to start a program can be the first step in them really being able to see some sort of growth within their community, which is always exciting. So from my perspective, one of the best things that you can do to be successful is, and I think it sort of speaks to what Ian just said, is make sure you have good partners at the table. Funders are much more likely to look favorably on your application if it shows that there's a lot of community support, and however you define community. So it could be a geographic community, population community, but getting the support of the others within your community and having them sort of actively at the table was important. And then I think to be, I'm trying to think of I'm trying to kill time so I can think of a specific initiative I've been a part of at a community that's been really successful. I would say there's a community I work with a lot in Southeast Ohio, and they've had a lot of good luck doing some what I would consider to be outside of the box work with specific to substance use. And I wasn't part of the generation of it, but I've seen it grow a little bit. So they do a syringe exchange program in a very conservative community. And so I think it's very, it speaks to the need down there, but also the importance of having support of the people and partners in your community. And they just really dug in and wrote some grants and got it started. And then they've had some just good funding come through. And I want to say they have the support of their community partners that serve in that role, but they, yeah, I'm trying to articulate this properly. But anyway, it's been really interesting to see it grow, and it's such a need down there. So I think sometimes we think political issues can hold us back, but there are if there's a need, I would say sit down with your partners and write a grant, think about the evaluation. And, you know, I think one of the main things is if you don't get funded, use the feedback you receive and apply again, because they oftentimes will provide you with a lot of useful information and tell you how to change your application the next time to make it more competitive. I am very guilty of earlier in my career getting my feelings like personally hurt if I worked really hard on a grant and it wasn't funded. So I think that not doing that and really reading what you did wrong and accepting that and using it to change your application is really key. So.
Thank you, Kelly. Melissa, I unmuted you. If you could feel free to introduce yourself and share more about who you've been working with, and then share your comment if you'd like.
Oh, sure. My name is Melissa Fetterman. I worked with the Title X program out of the Center for Community Solutions for a number of years. I'm actually consulting this year, which turned out to be a great move given all the work from home and COVID stuff with the kids, but continue to work on, HIV and birth spacing projects. And I'm on the ODH Women's Health Advisory Committee, and they actually met yesterday. So this is really timely, especially as you're thinking about evaluation, because they had come up with new special populations this year that they really wanted to reach with the Title X program. And one was women with substance use disorders or who are in treatment actively. And so they had, mentioned a number of new projects that we're starting this year, and that it's been really slow getting going with COVID because you're talking about sort of new partnerships and relationships with organizations that some of their grantees on the ground didn't have prior, as well as telehealth. And of course, when we're talking about, some methods, it's not as easy with telehealth. With some it's about a prescription, but with others it's about insertions and making sure that clients are feeling comfortable and have a local provider, et cetera. But like I said, there are several underway. So I don't know if there's anyone else on the line from the Ohio Department of Health who might be able to speak, with more detail on this, but that's, GRF, General Revenue Fund, Title X, Title V, their women's health is sort of funded by a number of federal and state resources.
So there is someone from ODH, and I will also unmute them so they can contribute to this conversation. So Molly, I just unmuted you, so go ahead and share any information if you'd like. Okay. Nothing from Molly. Maybe we can go back to Molly, but Syra, did you want to just give a brief overview of PCORI?
Sure. Thanks, Anne. And thanks, Melissa. It's nice to hear that there's, sort of more opportunities and work to be engaged in partnerships and evaluation. I think one reason why the PCORI grant may be a good space for this kind of work is that, the evidence is still building in this area as to what good integrated care looks like for women experiencing substance use disorders in the reproductive health space. And I think there's a lot of partners and a lot of good work that's going on the ground. So what PCORI does is it has two sort of levels of financing. One is to do a year-long effort to build partnerships and to build collaborative work. And really to identify what the major issues are that this collaborative could kind of pursue in a 3-year grant. And I think just speaking to what another person mentioned before, that maybe there's adaptations of tools that need to be client-centered or patient-centered. PCORI does also appreciate inquiry in that space. So not just about interventions, but how they're being perceived by patients, being perceived by clients, and really the acceptability of the solution. So I think, you know, if there is an opportunity, whether it's just within Ohio or whether it goes broader than that, PCORI might provide an opportunity to build the partnership and build the discussions and build good questions around patient-centered care, and then also prep a group of people to really pursue a more substantive 3-year grant. So I just wanted to highlight the 2 levels of funding.
Thank you. And I think when we were talking about it initially, we were thinking of kind of like a cohort of FQHCs, right, Sire?
Yeah, exactly. And it may be in that sense, and maybe bringing other academics into it. So really having like a mix of different partners. It could involve ODH, like Melissa was saying. So just trying to bring in a variety of voices first to figure out, you know, what are the primary questions? Like, I think through the seminars, we've been hearing a lot of great work that's already happening, but how can we bring these ideas together and really have something that is, and I say evidence-based in the sense that, you know, those are things that can be funded through other mechanisms once you build the evidence base.
Yep. Thank you. I think Molly, if you're ready, I think we're ready to hear you. We're still not hearing anything, Molly. It looks like you're still muted. Okay, now you're not muted, but maybe your microphone isn't working. I'm so sorry. Very strange. There was another question that we had in our Q&A. Molly, I will go back to you, but someone asked if there are any insights or examples of programs targeting refugee background populations. And from my experience, I would have to say no. I know that in Columbus, there are a couple of organizations that serve the refugee group, but I'm not sure if they have any specific initiatives in the intersection of substance use and reproductive health. Okay. Anything else we can discuss as a group while we have this opportunity? I did put the link to our website into the chat, and it does feature a foreword that Dr. Turplin wrote for us to kind of kick off our focus on this. And then it also has a data brief that the Center for Hope's put together. We will release a longer paper, but the brief is accessible now and you can review it. It gives a high-level summary of the dual burden of substance use and reproductive health needs in Ohio. So I did get a message from Molly. I will be emailing her from ODH. So if she has additional resources, I will collate them all and put them together and send them to all our participants. Okay, Kelly, do you have any last thoughts?
No, I think with any sort of initiative, starting earlier is the best. So if you have an idea for a program, start gathering all of those, you know, start that logic model. What are the resources that you already have and the partnerships you already have at the table? And, you know, I think sort of what I said before, don't let sort of failure in the past stop you from trying another initiative or another grant application, and just, you know, keep trying. You guys are all doing really great work.
Yes, Saya brought up a good point about sustaining our connection. So again, we do have another session in December, and it's really an opportunity for participants to connect with and direct any questions to the leaders in this space and also the funders. But I do have a list of everyone who is registered. I have contacts for all of the presenters. So if you email me and you want to be connected to an organization in a certain region or anything like that, I can provide that information to you. I don't think it's appropriate to share everyone's email with each other because I didn't really get that permission when we asked you to register, but I will try to facilitate connections to other people if you are looking for partners to develop out an idea. Okay, Syra or Melissa or Karen, any other words of advice or next steps for our group to kind of activate this work in Ohio?
I would like to follow up probably with Melissa afterwards, maybe Molly, Melissa, and we could think about connecting to see what other work is sort of bubbling up from ODH. And even if possible, because I'm not sure for next week's session or the next session, and do you have someone from ODH joining in?
Yes, we have Rena Azza Frank, who is the, I think, director over the Bureau for Family and Maternal Health or something like that. I'm misrepresenting the actual office, but
Okay.
joining from ODH.
Yeah, because I'm wondering if appropriate, we could prompt her to kind of talk about what Melissa was mentioning, if it's appropriate during that time, to kind of think through these sort of special groups, special populations that might be a focus for Title X. So maybe we can connect on that.
Yes, definitely. And if other attendees have questions, you can certainly send them to me. I will be developing some guided, facilitated questions for our panelists. So if there are things that you want to bring up, I can certainly include them in the Q&A.
And I would just add, this is Melissa again, that I know you've talked about this on panels, earlier this summer and fall, but there's been real recognition, I think, among the federal funders of the importance of integrating, right, these types of services, and that's now what you're starting to see play out in Ohio with these, these pilots that we saw some successful sort of, early data coming from, and then it got added to a special POPs list essentially. So there is some movement. Of course, everything always takes longer than we hope it will, but now there's new funding, there's new clinics doing this work, and we have a couple of models to work from. So that's all really good news.
Yes, and I think along with the lack of initiatives, there's definitely a lack of data and evidence. So that's why we really encourage everyone to develop really strong evaluation plans so we can each contribute to the science and have a deeper understanding of the challenges. Okay, well, thank you for joining us today. I know that we were kind of all over the place with this session, but again, I really wanted to take the opportunity to activate us into action. And I hope that this is a continued conversation that you all will have with everyone in Ohio and within the country, and especially at OSU. So if you ever need anything like templates or tools, or you're interested in a grant, or you're interested in being connected to some of the partners that we highlighted, please feel free to reach out to me. And then I will stay in touch with everyone for the evaluation and your CEUs. And I hope to see everyone in December for our stakeholder panel discussion. Bye, everyone.
Thank you.